What's the difference between DCD and brain death organ donation in ICU? My name is Patrick Hutzel from intensivcarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence, even if you're not a doctor or a nurse in intensive care, so that your loved one gets best care and treatment always. So if your loved one is in ICU and ICU doctors are talking about organ donation, you need to understand the critical difference between DCD, donation after circulatory death, and brain death organ donation. ICU teams often push families towards organ donation decisions without giving you the full picture. That's why we're here at intensivcarehotline.com, to make sure families in intensive care can make informed decisions, have peace of mind, control, power, and influence, and make an informed choice based on facts, not pressure. Let's break this down. Brain death organ donation, what it really means. Brain death is a legal definition of death, but it can be controversial. When someone is declared brain dead, their brain has permanently stopped functioning, but their heart is still beating, usually with the help of a ventilator and a breathing tube. What doctors often won't tell you is this: even though your loved one is declared quote unquote dead, their body is warm, the heart is beating, and they may look alive. This confuses many families of critically ill patients in intensive care. So why is this important? Because organs from someone who is brain dead are well perfused with oxygenated blood, meaning they're in an ideal condition for transplantation. That's why there's often pressure to declare brain death quickly to retrieve the organs before deterioration. Organs that can be donated in brain death: heart, lungs, liver, kidneys, pancreas, intestines. Let's now look at DCD, donation after circulatory death. What they won't tell you. In DCD, donation after circulatory death, your loved one is not brain dead. Instead, the family agrees to withdraw life support, and the medical team waits for the heart to stop beating. After a 2 to 5 minute no-touch period, death is declared based on circulatory criteria. This is called controlled DCD and is used when the patient has a devastating brain injury or terminal condition, but does not meet brain death criteria. Here's the catch: because the organs are not getting oxygen during the dying process, there's risk of damage from warm ischemia, a lack of blood flow that starts when the heart stops. Organs typically donated in DCD: kidneys, liver, lungs sometimes, pancreas occasionally. The heart can rarely be donated after DCD, only in very specialized cases. So let's look at the summary from DCD versus brain death donation in simple terms. So the criteria: when is death declared by? So in brain death organ donation, death is declared by neurological criteria, i.e. the brain function stops. In DCD, death is declared by circulatory criteria, i.e. the heart stops beating. So next criteria is ventilator support. In brain death organ donation, it's yes until organs are retrieved. DCD organ donation, life support is withdrawn first, then death occurs. Next, organ perfusion. In brain death organ donation, organs remain perfused and oxygenated. DCD organ donation, perfusion stops, risking organ damage. Next, common organs donated. In brain death organ donation, heart, lungs, liver, kidneys, pancreas, intestines, and DCD organ donation, kidneys, liver, lungs, which is limited, or obviously limited number of organs. Next, time to retrieval. Brain death organ donation, immediate after death declared. For DCD organ donation, delayed due to withdrawal, waiting period, and death. Here's the bottom line. Don't be pressured, get informed. Whether doctors are talking about brain death or DCD, you have the right to question, pause, and get a second opinion. Don't let anyone push you into making a rushed or hasty decision. We've seen it too many times. Families in intensive care being told there's no hope when their loved one could have lived or recovered if only given more time, support, and also optimism. If you need help understanding your rights, asking for more time, organizing second opinions, exploring home care with a tracheostomy or ventilator, contact us now at intensivecarehotline.com or call us directly. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.